This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
We've all had infections at one time or another. Usually the doctor prescribes us an antibiotic and we're on our way, but sometimes the body can have an extreme reaction to an infection, creating a life-threatening emergency. It's called sepsis. According to the CDC, about 250,000 people die from sepsis each year. Chief Safety Officer and hospitalist at PRMC, Dr. Snyder, joins us this afternoon with more on this dangerous condition. Thank you so much for coming in.
Thanks for having me.
So, can you simplify sepsis? Can you kind of tell us what it is for those of us who don't know?
Yeah, so it's really septicemia. It's a syndrome that occurs from an infection. Infection is caused by bacteria and viruses. They're animals. As animals, we all have moments where we urinate, bowel movements, all those things occur. Well, those are toxins in the blood. So if you get an infection, those animals secrete toxins. Those toxins are what cause the septicemia. Unfortunately, you can kill the bacteria, but you still have those toxins around. And that's why it's so hard to recognize. Those toxins are toxic to your heart, to your brain, to your eyes, to every part of your body. And getting rid of those toxins, the body has to do it for itself. It's not like we can go in there and just kind of suck them out and get rid of them. So those toxins are what create septicemia and cause all the symptoms of septicemia.
So I guess you could say it kind of sucks the life out of you from the inside.
Yeah, well, it kills your organs basically. So, and it kills your organs by manifesting itself as low blood pressure and increased heart rate. And then you throw a fever on top of that. We all know what we feel like when we have fever, chills, rigors, and all those things, shaking. And it's a normal environmental a threat to everybody from a medical standpoint.
Do you see a lot of cases of it on Delmarva?
Yeah, throughout the country. So anywhere humans live, we're in our environment, we have bacteria, which is the main cause of this. And certain bacteria, E. coli and MRSA, everybody hears about those in the community. But when those get overgrown and they get into that effective toxemia stage, that's where people present to us extremely sick. And a lot of it's time dependent, so the earlier you get there, the better. It's one of those things that it's not predictable, so it's very challenging.
So what are the types of people that are at risk for sepsis?
Yeah, so again, anyone who has an immune system deficit, so any of your patients with cancer, elderly, the very young, the very old, the immune system has to kill the bacteria, so if it lets it overgrow, diabetics are a classic example where they get wound infections that seed the blood with bacteria. Once the bacteria is in the blood, all of that toxic event occurs.
Are there any lifestyle changes that we can make to help prevent sepsis?
So hand hygiene, you know, good hygiene in general, cleanliness is important, good diet, good activity. Unfortunately, we all get old, you can't stop that, so I can't help you with that one. So unless you got that aging agent, but I haven't found it yet. So there's a lot of elements. Cancer is kind of hard to control. If I put you on chemotherapy, you're at risk for sepsis.
So what are some symptoms that I could look out for? I know you mentioned, you know, we all get colds. Are they similar?
Yeah, so fevers that are persistent more than 72 hours with chills and rigors and shakes. If you're one of those people in a high-risk population, you're on cancer agents for chemotherapy or radiation, or if you have a chronic condition, chronic catheters for dialysis patients, all those folks should be the high alert folks, and they should look for fevers. They should come sooner than later. If you're a healthy individual, 3 days of fever, you should probably go see somebody, and that's kind of the general rule. Get into your doctor's office, let them evaluate you, do some vitals, do some labs. Just from those early things, we can kind of identify how sick you are.
So if we catch it soon enough and we do manage to get to the hospital, how is it treated from then on?
Well, bacteria is treated with antibiotics, so that's the main frame. If it's viral, it's a little more difficult. But antibacterial agents, we use pretty high potency drugs for that. And then we also use fluid resuscitation. Believe it or not, this septic event occurs. Usually what happens is you get so dehydrated, your organs kind of get sucked of all the volume of fluid. So fluid is one of the main frames. So we actually have to measure the first 6 hours of care in severe sepsis patients, looking for those identifiers. We've had that in our ER for at least 5 years now, and we actually report those elements of care back to CMS as a nation.
So do you think we're moving forward in the right direction as far as, I guess, preventing it or treating it so that fewer people die from it each year?
Absolutely, yeah. We utilize certain lab values. We have technology is wonderful. Instead of waiting for the bacteria to grow by our microbiologist, which can take 3-4 days, Now we actually have gene probes, so we can look at the bacteria, and within 12 hours we can identify the bacteria, treat it much sooner with really very specific antibiotic targets. So yeah, technology is helping some, plus education and just learning. That's why I'm on TV today. I want everybody to know about this.
Sure.
It's very common, as you said. Everybody's had somebody in their family who's died of related to sepsis. If you think back, they probably had underlying disease also that may have predisposed them to it. We do see occasionally young folks come in with these horrible septic syndromes and they get very sick, but they usually survive because we get them early.
All right. Well, Dr. Chris Snyder, we certainly appreciate you being on the show.
Thank you.
Thank you so much. We appreciate it.
Thank you.